Good afternoon and welcome to the Department of Behavioral Health's weekly update. And as I promised last week, we're going to have Dr. Tran with us. We decided we would bring him to the weekly update, not just so that you could ask him questions during the update, but so that it would be recorded and can be shared later. So without further ado, I'll do the rest of the presentation after we're done with Dr. Tran in order to respect his time, but we're going to switch over to Dr. Tran now.
Great, thank you. Thank you, Dewan, for inviting me, and it's an honor for me to be able to share some information in relationship with the vaccination for the COVID-19. I do want to let everyone know, I think it's very important for everyone to be able to receive the vaccination because I think it would help in many different ways with the pandemic. I think it's one of the most effective ways that we could try to prevent transmission as well as prevent any complicated health issues as a result of COVID-19. So I do want to share that it's extremely important. So I think everybody should really get it. And I want to also share a little bit of my own experience. I did receive the Pfizer vaccine. I have received both of the vaccines now, both shots with 21 days in between. The first shot I did have some reaction, just to let everyone know, which is usually it's not typical to have a reaction, but it is possible. And the reaction I have is I have muscle pain and fever and fatigue, and it only lasted 2 days for my first shot after I received it. Also the pain on the injection site also. And the second shot when I received it, I have similar reaction and it only lasted 1 day. So now I'm all over. So someone say, well, I don't know, I don't want to have any reaction. I say, well, you know, sometime might not be bad though, because then you know for sure you got the real vaccine, right? So that's what I kind of jokingly tell them. Yeah, so, but I do really want to emphasize it. It is, yes. Yes, and it's not, it's not only just for the COVID-19 vaccine. Actually, those type of symptoms are pretty common even for other type of vaccine like the flu shots and things like that. So it shouldn't be anything to be alarmed about. I think the reaction that most folks are alarmed about are those severe allergic reaction, which is very, very rare. I believe the last time I looked, it's like maybe 12 individual that receive all the vaccine in the world had that. But those are very, very rare reactions though.
Yeah, and I think I reported last week that 29 people out of the first 5 million doses had that.
Okay.
But all of them were treated and had recovered fine.
Yeah.
Yeah, and
I think now sorry, go ahead.
No, just so our staff knows, at our vaccine site, not only do we have nurses, but we have a doctor on site, we have EpiPens and oxygen.
That's great though. Then most of the safety precaution that we need is all available there. So yeah, that's wonderful to know though. Yeah. So I didn't know if anyone have any questions related to the vaccination or any concerns or myths that you might have heard.
Yeah. While we wait for questions, I'll ask some questions. And Brian, I'm getting that echo again.
Yeah, I'll unmute it.
Okay. Basically, when you say that you felt ill, how ill were you? Like you were still functioning, just not feeling good, or?
Yeah, so typically I just not feeling good overall. It's kind of like having a mild cold at the beginning. I myself did not have any respiratory symptoms though. I just have a very mild fever, muscle aches, and just feel tired.
Yeah.
Okay. But that's about it though. Yeah, it wasn't anything debilitating or anything like that.
A couple of our staff who've had the Moderna have said they felt a little nauseous after. I know I had the arm soreness. I still have a teeny bit, but that was it for me. No other issues.
Yeah. I think maybe another common side effect also is headaches. Some folks reported they might have a little bit of headache too.
Okay.
At times.
Okay.
Yeah.
Yeah, and I think it's good for people to know that when your body reacts to a vaccine, it's building its immune response. And so all of those symptoms are that, right?
Correct. That is very correct. Yeah. So it's just a natural response that our body has, when we're building immunity toward a virus, toward a bacteria, any type of infections, or any foreign body actually in our system also. So it's a very common response. So it's nothing particular to the COVID-19 vaccines that are just causing these issues. It's just a natural response from the body.
Great.
Yeah.
All right. Any other questions? I'm not seeing questions. Gonna look at my text. Sometimes I get them through there. All right. Well, if no one has questions right now, Dr. Tran, if they come up later, we'll send them to you and then we'll report out on it next week.
That sounds great. Well, thank you very much for inviting me, and I hope everybody should go out and get your vaccine when you have the opportunity. Thanks.
Thank you.
Thanks.
Okay. Our first call-in kind of presentation. So thank you for bearing with us with the difference in technology. So as you heard from Dr. Tran, he's had both doses of the Pfizer. In our clinic, we're doing Moderna. So thank you to those of you who were able to get your appointments in this week. We'll continue to vaccinate for the next few weeks. We think by the end of next week, everyone in the department who is ready to take the vaccine would have had a chance to get it. And then we'll probably have a couple more weeks of initial shots available. And then we'll be scheduling those second shots for people who got their first shot already. And so I encourage a few people on the questions have mentioned what their experience was. I encourage you to put it on there. We want to know what people are doing. This says, is it true if you are allergic to the flu shot, you should not get the COVID shot? I am not aware of allergies to the flu shot. I know that the basis of the COVID shot, the mRNA technology, is different than the flu shot, and so I am not aware of that. The only contraindications we've heard to getting the COVID shot is if you've already had a vaccine within the preceding 14 days. And any sort of vaccine. I'm not talking about a COVID vaccine. If you've had the flu vaccine or pneumonia vaccine or that type of thing, you'd want to wait 14 days. If you have a known history of severe anaphylaxis, you would want to talk to your physician, and then we would observe you for 30 minutes instead of 15 minutes to make sure that that reaction doesn't develop over time. But I would just encourage you to talk to your family physician and get their input on that. Another question, I've read that the second dose is what really provides a protection. Is the second dose most likely to cause more side effects? Both doses provide protection. The first dose initiates the immune response, and the second dose initiates a second immune response, and they do believe that that additional immune response kind of hardens your immunity towards it. As far as more likely to cause side effects, I've heard different things. Dr. Tran said his second dose was less side effects than the first. And so I think that if you had side effects the first time, you might anticipate having those side effects the second time. But I'm not hearing that there's some direct correlation between the intensity. Someone else said they got lightheaded, nausea, sore arm, headache, and tiredness. That's pretty common responses. And another one, small headache, some soreness, a little nauseous. And then, anyhow, someone else said it took 1.5 hours this morning. We're ramping up the availability of, or the capacity of the clinic. So in the beginning, those of you who were early adopters of the vaccine, you got to go to a clinic that was managing about 120 people a day. Today, they anticipate doing 280 doses in our clinic, and starting next week, about 330 to 60 every day. And so it is going to get a little busier. The lines will be a little longer. The wait time could be longer. There's also sometimes a little bit of time depending on if people come and they are registered, but they come at the wrong time. And when I say wrong time, I don't mean they're wrong. I just mean they come at a time that wasn't the appointment they registered for. Then if we get a bolus of people, we don't always have vaccine ready. And the vaccine comes out and it has to thaw out for a period of time once it comes out of the freezer. And then there's some preparation that has to happen. So there can be delays. I know yesterday we decided to add some doses, some appointments to the day because we were getting a good response to our invitations. And so we had a little bit of a delay in the afternoon when we were waiting for that vaccine to get ready to be given. And so it may be a little bit of a wait, but in my opinion, it's worth it. I hope you guys feel the same way. Another one, soreness at the injection site. And that was, exactly the same thing I had. Mine's a lot less sore today than it was the first couple of days. And then another person said when they get the flu shot, they usually have the same reaction that Dr. Tran described, but they've had zero reaction to the COVID vaccine they received yesterday. So, here's someone that had a different reaction than what they've had to the flu vaccine. Little sore at the site of the shot, felt a little warm briefly later, light perspiration on my forehead, then that cleared up, excellent. How many days do you wait for the second dose? The Moderna vaccine is a 28-day waiting period. It's actually, I think, 24 to 28 days. So if you've already gotten your first dose in the next week or so, you should expect to get an invitation to a set of clinics that's within that window of time for the date of your dose. So for instance, if you got it on the 1st, then either the 25th, 26th, 27th, in that range, you'll get some clinics sent to you, and you choose one that works with your schedule. And that'll come out shortly. Someone else was nice enough to share that 28 days on here. Someone said they're grateful, thank you. And yeah, the vaccine card they give you shows the date. I will say, I want you to hear from me now. If you don't get it exactly 28 days, it is not the end of the world. It's my understanding that you don't want to get it before that 24-day period, but any time after that is fine. But we'll offer you appointments within a window of time. That's what's considered the window that's appropriate. And so you should expect to get that invitation if you got the vaccine. When you got the vaccine, you should have registered, and in that registry, we're able to select a group of people and send them new invitations. So that's kind of how it's going to work. We're setting up those clinics over the next few days. The way the system works, that system that you accessed when you hit on that link and it goes in and asks you for some information, and then you have the opportunity to schedule an appointment on the date of that registration link that fits your schedule. And so you've put information in there, and that enables us then to go and send you other information. But we're also able to moderate that in terms of adding extra appointments and such. Someone said they felt super whiny after their vaccine. What's the research behind getting the shot while pregnant or trying to conceive? Have there been any birth defects like the polio vaccine? Again, this is a situation where I do not believe there's been enough time that we can reliably say that that's been researched. And so that would be something for you to discuss with your physician about the advisability of getting the vaccine if you're pregnant or hoping to become pregnant. How do we get it for our family members, or at least are immune compromised? So Brian's going to put up in a few minutes the schedule, and this is the schedule driven by the CDC about when, in the scheme of things, different groups of people get the vaccine. And I'll talk then about, here it is. And I can't quite see it, so I'm just going to, it's all right, I can pull it up here. So basically, the first groups that are being vaccinated now are phase 1A. That's all of us, long-term care facilities, paramedics, EMTs, and others providing emergency services, skilled nursing facilities, et cetera. Intermediate care facilities, public health field staff, primary care clinics, including federally qualified healthcare centers, correctional facility clinics, urgent cares, home health, in-home supportive services, and a big push starting next week to get our in-home supportive services staff vaccinated. Community health workers, including promotores, specialty clinics, laboratory workers, dental and other oral health clinics, and pharmacy staff not working in settings in higher tiers. And then phase 1B has started as well. At this point, that's individuals 75 and over. I anticipate next week 65 and over will be added. And then shortly thereafter, food and ag, education and childcare, and emergency services. In March, this kind of ignore the months on here, because if we start seeing that there's capacity within all of the clinics that are being offered and people are being invited and not taking us up on it, then the tiers will get accelerated. And so it's possible tier 2 in phase 1B will happen before March, for instance. So individuals experiencing homelessness or who are unhoused, incarcerated individuals and those in jails and prison, transportation and logistics, critical manufacturing, industrial, commercial, residential, and sheltering facilities. And then the last phase is pretty much everyone else for the most part. Well, almost everyone else. It's individuals who are between the ages of 50 and 64, regardless of other health conditions, 16 to 49 years with underlying medical conditions, disabilities that place them at high risk, and water and waste management, defense, et cetera. A lot of categories. And then after all of that, it will be the general public. And so when we get towards those phases, it's going to become less about the availability of an appointment and more about the availability of the vaccine to create the appointment. We're not quite there yet. Right now, we have enough vaccine that we can increase capacity of clinics, provided we have the staff and the location to do so. And so where you see clinics now, you see the one at the fairgrounds. It's operating at about 1,500 individuals a day. There's a couple of other entities in town that are offering healthcare workers in the private practice field and people who are 75 and older a drive-through option. And then the federally qualified health centers will start next week. The in-home supportive services will start next week. Individual physicians can also become vaccine providers. I know that the county is looking at using the Pinnacle folks who are doing the testing to potentially be available to do vaccinations. They're not a vaccine provider yet, so that's going to take a little bit of time as well. But we'll increase our capacity significantly as we get further along in the tiers. What I would tell you thus far is we have been able to go through our populations quicker. I think that's partly because we ramped up our capacity and partly because not everyone's ready to take the vaccine yet. And so my hope is that for those of you who are hesitant to take the vaccine, who might take the vaccine, that as you see that those of us who've had it are doing okay, that will give you some reassurance. And as more and more people across the world are vaccinated, we learn more. That's how all vaccines work. That's how most medications work. We have pretty large sample sizes for the vaccine studies of like 30 and 40,000 people, which is actually pretty good for most medical research. But with most medications as well as with vaccines, until you really disseminate it to larger populations, some of the rarer reactions you don't see until millions of people get it. So that small number of severe anaphylaxis is as we begin to see that, then the different vaccine centers have EpiPens and oxygen and that type of thing to be able to respond to that. And it may be some time before some of the other concerns can be addressed so that research is being done. So for instance, right now, some of the vaccines that have already been approved are doing research on a younger population. The Pfizer can be given 16 and over, but the Moderna is 18 and over. So right now we don't have an approved vaccine for anyone under 16, but research has been started on that population. And I imagine there'll be some research done as well on individuals who are pregnant or people who've already been involved in vaccine research or got the vaccine and then become pregnant. We'll be able to track them and see what their response is. Thus far, there's not anything that we know about that, so that's something that we'll be watching. All right, we're going to jump into the presentation. So we're now over almost 93 million people across the world have had COVID and approaching 2 million deaths worldwide. In the United States, it's over 23 million individuals have been positive for COVID and almost 386,577 deaths. And so we're now approaching 400,000 deaths. And I got to tell you, 6-8 months ago when you saw those models of 300,000 to 400,000 people and people said, that's never going to happen, it's here. We're actually experiencing that. In California, we now have almost 2.8 million cases of COVID and over 31,000 deaths due to COVID. And that's, you can see on the right, that's climbed. In terms of the positivity rate, 12.6% across the state over the last 7 days. That was 13.4% if you look at the whole 14. So that number is coming down because over the last 7 days it's a little lower. So the positivity rate across California is coming down, and we'll talk about that in a minute. In Fresno County, we now are over 78,000 cases and 846 deaths. So since we reported out a couple of weeks ago, we've added about 135, or last week, we've added about 135 deaths. We should expect that number to go up. By all accounts from hospitals and such, they actually are really struggling right now with the number of individuals who are dying, and so we should expect that to go up. I do want you to look at the top graph, though, in terms of cases. Some of those really high spikes were because we had some days where we had like a bolus of cases come in. But you'll see it kind of went down a little, and now the cases seem to be trending up. But that's just a pretty new phenomenon just over the last few days. And if you go to the next slide, you can see in terms of positive people in the hospital, we seem to have kind of plateaued around 620 or so. We had a high of 659 in the last 2 weeks, or last week, but we're staying around 640, 630, 620 pretty much every day, and the ICU has actually dropped a little. We think the ICU has dropped because we saw that drop in cases a couple of weeks ago, but as the cases go back up again, we expect the ICU to go back up again. And so you can kind of see that progression here. Where we had 626 people hospitalized last week, 623 this week, 114 in the ICU that week, last week, 92 this week, but still very, very few ICU beds available. There are about 149 licensed ICU beds in Fresno County. That number of available ICU beds is actually higher right now because they've created ICU beds that were not ICU beds, or they weren't licensed as ICU beds previously. So that helps you know that if there's 92 people in an ICU bed with COVID, and there's over 150 ICU beds and only 11 available, then there's other reasons that people are in the ICU. Okay, in terms of the tier system for reopening, you can see here that unfortunately our positivity rate just keeps going up. We're now at 19.4%. We also keep going up in the number of new cases per day. This is why we don't think we're really going to go down in hospitalizations and deaths, because all the precursors to that continue to be concerning. And so we're well in the purple tier, frankly. Some of you may have heard that Sacramento got taken out of the shutdown due to ICU capacity. So they have a little better ICU capacity than we do in this area. And I presume that if we got to a better ICU capacity at some point, they might consider taking us back to the traditional purple tier, but we're not there yet. And all of this really is to get us to the point to say, it appears that we have not been particularly effective over the past few months at getting people's behavior to be consistent enough to prevent the spread of COVID. We also have new variants of, mutated variants of COVID that appear to be more infectious. So some of our traditional measures may not be as effective either. And particularly if we're not following them, it's even more likely that you could get COVID. So that's why we're really putting an emphasis on the vaccine, because to get to that herd immunity that any virus has to get to in order to not have it be disruptive or as prevalent, you really have to have somewhere between 60, 70, 75% of the population either has had the virus or has been vaccinated. At this point in Fresno County, known less than 10% of our population has had the virus. So we're at about 78,000. We have over 1 million people. Even if we presume that another 100,000 people had it and didn't know they had it and didn't get tested, that's still only 20%. And so the only way we're going to get to herd immunity and get out of this terrible cycle of surge is either go into another surge and more people get it and more people die and more people, have help contribute to the herd immunity, or get vaccinated. The other thing is, to get to herd immunity with having it, you have to not be able to get it again. And right now, we don't know how long your immunity lasts after you've had it. It seems right now that 90 days is pretty reliable, so most people who've had COVID are unlikely to get COVID again, at least within that first 90 days. But even if you've had COVID, we're recommending that you get the vaccine. Just as added protection. There's been a few isolated cases of people getting COVID again after they've already had it and recovered, and so that's what we're trying to guard against by having you get vaccinated. So our clinic is ongoing. As I mentioned, starting next week, we'll be giving somewhere around 350 shots a day, or have the capacity to do so. Those second shots will be scheduled soon. You should get an invitation if you've already had one shot over the next week or so. The population we're serving in that clinic is expanding. We do anticipate beginning to include individuals who we serve who fit into those tiers. So our older adult team should be working shortly over the next couple of days to identify individuals willing to get the vaccine and get them scheduled in our clinic. As soon as it goes to 65 and over, we'll get them in. And then we're also going to go ahead next week and vaccinate individuals on conservatorship or on public guardianship. If you work in those areas and you haven't heard about this, this is late breaking news. Welcome to my world. It changes every 5 minutes. So don't become alarmed if you're not aware of what those plans are. That's okay. We're going to be working very diligently over the next few days to begin that process. And that's what it will be. It's the beginning of a process. It doesn't mean if they don't get vaccinated next week, they won't get vaccinated. It means it will begin to allow them to schedule appointments. If we can't get them in next week, we'll get them in the following week. And so as those tiers open up, we'll be using our clinic to vaccinate our staff. And there's going to be a lot more clinics to vaccinate the broader public. I know people have a lot of questions about their family members. If you have family members over the age of 75, the clinics at the fairgrounds are available for them. And then they should also check with their primary care physician. And starting next week, I do believe those clinics will begin to open up to those who are 65 and older. So the best thing to do is stay, close. Well, check in with us every week in this update where I try and give you the most up-to-date information. If really new late-breaking news happens, I'll send out an email to you. And then you can also check in on the public health website for COVID, and they have a special vaccine page, and on that page is public access to those clinics. So anyone can scroll to that page, hit the link, and make an appointment. I will ask all of you, and please share this with your family members, Do not schedule duplicate appointments. So what I mean by this is don't say, well, I think I can go Wednesday at 4 o'clock, but I'll also schedule one Thursday at 9 a.m. just in case I can't make Wednesday. You legitimately are taking away a spot and capacity for that person to get a vaccine shot by taking up 2 shots. Do not do this. If I find out that you've done this, it's not going to be good for you. Please do not do this. It's really not fair to everyone to take up capacity because of your scheduling. If you're having a hard time scheduling, please contact us and we'll work with you. If you make an appointment and you're not able to make it, please work with us to get that appointment canceled so we can open up that spot to someone else. Legitimately, also, if you schedule a spot and you don't show up, and we don't know you're going to show up, we could end up at the end of the day with a vaccine dose that has to be wasted because there was no one to give it to. That's no good either. So make an appointment. If you find you're not going to be able to make it, please cancel that appointment. And if you can't find an appointment that's convenient to you, please email DBHVax directly, and we'll work very closely with you to try and accommodate your schedule. We want you to get vaccinated. We'll work with you to get vaccinated. We just don't want to clog up the system with duplicate appointments or missed appointments that put at risk that our vaccine doses would have to be wasted. We are, at the end of each day, trying to scramble quickly and give it to people who maybe are on the list the next day and such, and I appreciate anyone who's been able to respond to that. I know on Tuesday I walked around the building here and asked anyone who had an appointment for Wednesday or Thursday if they could run over and get their shot today so we didn't have to waste, and fortunately we have not had to waste any shots so far, so cross your fingers. Okay, I'm going to okay, the rest of this presentation is really what I presented last week. It's just a very quick review. That 5 million doses, 29 allergic reactions, all fine. If you have a history of anaphylaxis and you're getting the vaccine, you'll be monitored for 30 minutes instead of 15 minutes. We do have a physician on site and treatments on site, so you will be safe. And the only people who are recommended by the CDC to not be vaccinated are those who've had a severe reaction to the first shot, but no other worrisome trends other than what we talked about, some things not known with pregnant or hoping to be pregnant. What you should expect if you choose to get vaccinated, you'll get Moderna. I know at the fairgrounds they were giving some people Pfizer. They may still be giving some people Pfizer. That's a possibility if you go to the fairgrounds, but our clinic is just doing Moderna. 2 doses, 4 weeks apart. You'll register for an appointment, and after the vaccine's given, you'll be monitored for 15 minutes, and then you'll get a follow-up request to schedule an appointment 28 days later. You can have those expected normal side effects. Dr. Tran talked about his. A lot of people in our chat talked about the sore muscles, tired, fever, etc., headache, that kind of thing, discomfort at the injection site. And remember, even if you get vaccinated, you still have to follow precautions. You don't get to not wear your mask. You don't get to get in people's face. You still are going to follow those precautions because it's possible that you could have COVID on your body, on your person, and spread it even though it's not coming out of your body. It's also possible that you could still have COVID in your body but not experience the symptoms because your immune system is fighting it. So there's still some things we don't know. You have to continue those precautions. The vaccine remains voluntary. If you choose not to get it during our clinic, you can go any other time. And we do anticipate that eventually we will return to work. I know every week people ask about, can I stay at home working? And that will always be something that we'll be looking at. But whether or not you've got the vaccine won't prohibit us from asking you to return to work or you from returning to work. Okay, so let me answer some questions again. Few more people talking about maybe feeling a little sick afterwards, tired, sore at the injection site, fatigue and nauseated. Where was the IHSS located on the list? What tier? IHSS is in tier 1A, I believe. Can you pull that up again, Brian? And I'm going to look at it here, actually. In-home supportive services is under Vaccinating Now, and so they are in the tier that we're in, and that's why they're getting started. Children under 16 will not get the vaccine until enough research has been done proving that it's safe. And so as I mentioned earlier, I believe it's Pfizer right now that you're able to give the vaccine. 16 and over has started a study on kids under the age of 16, and so that will be completed before they'll authorize it. If a child under the age of 16 is immune compromised, is it recommended that they get the vaccine? That's not anything I can recommend or even comment on. That would be something to talk to your doctor about. I am 100% confident that we would not give the vaccine to someone under 16. That would be something that your physician would have to do because it's outside the emergency use authorization. These vaccines are under what's called an emergency use authorization, as are many of the treatments for COVID. And what that means is, you can use them within a certain framework, but you would have to talk to your doctor. I don't know that they would be willing to do that. Someone said IHSS is able to get vaccinated now. I suppose they are, but they're not. There's not a set site for IHSS, and that is opening up next week. And that will not be at the fairgrounds. That, I believe, will be near the fairgrounds. I don't want to comment right now because that's something that's another department, and they'll advertise that to individuals who are IHSS providers. And so they have a separate clinic that individuals who are IHSS providers will go to get vaccinated. It will not be at the fairgrounds. Unless they change. Someone answered and said it would be, and it's not going to be at the fairgrounds, but it could change. And then, most of the clinics that are for healthcare workers or like IHSS, you will have to prove that. We're really trying not to let people jump the tiers, and so we're trying to stay within the tiers as much as possible. They'll have to show that they're an IHSS worker. Can you clarify education? Is that staff from K-12, teachers, administrators, higher ed? I believe, yes, that it's any educational position, but I didn't define it, so that's something that as we get to that tier, we'll be able to have public health share the plans for that. School nurses were part of the healthcare worker tier, so most of the school nurses have either been vaccinated or in the process of getting vaccinated right now. Part of the plan is to have school nursing staff administer vaccinations to school staff so that we don't have to have school staff coming to the fairgrounds or that type of thing, only because we need to expand and have as many vaccination sites as possible. So anywhere we have qualified staff to administer the vaccine, primary care providers, your family practice physician, federally qualified health clinics, we're pushing those vaccine clinics out because it would be impossible to do all of the vaccinations at the fairgrounds. That's another reason why IHSS will be at a different site and why our clinic is at a slightly different site. You're having to deal with parking and lines and navigation, all of that. The more clinics we have, the better it will be to be able to accommodate the vast population's needs. But I do believe the education folks, by and large, will have what we call a closed system. So we had a closed system at our clinic where only by invitation are you going to come to our clinic, versus the fairgrounds, which is an open system where they have a public website. Anyone can go there. As long as they meet the criteria and can prove that when they show up, they can make an appointment. And so that's an open site. I believe that the education system will have closed sites where it will be specific to either a school district or even on a campus, I believe. Yeah, so your mother and her friend are both IHSS. If someone meets the criteria, if they, scheduled an appointment and they identified themselves as a healthcare worker and they were able to show ID, yeah, they could go to the fairground and get vaccinated. But there's a lot of IHSS workers that don't meet the tier requirements otherwise, and so this big effort that's going to start next week is to make a place for them. It's just like all of you. You could have went to the fairgrounds too. You did not have to come to our clinic. And so there's going to be people in the public for which there could be teachers that are over 75 that get vaccinated before the rest of the education system does. There's also people that, maybe they said they were healthcare workers and they let them get vaccinated, but they didn't really meet the strict criteria. So that's going to happen, but as much as possible, we're trying to stick to the tiers. How short of nurses are we? Frankly, nurses right now are not what I would call the rate limiting factor. And what I mean by that is that in our clinic, our capacity for vaccine delivery has less to do with the availability of the nurse to put the shot in your arm. Those of you who've had it know it was pretty quick. It's more the logistics of moving people through the space safely, having enough space between people, having the observation area, etc. And so that's why, for instance, at our clinic, we thought that we would be able to do 250, and today we're going to do 280. And next week we're going to do 350 with less nurses than we had this week. So we're learning as we go, and we're finding that we probably can have fewer nurses than we thought because that's not the rate limiting factor. And then we're looking at other things. So I know at the fairgrounds they're looking at having different queues or lines based on appointment time. Right now it's just one big line, it's chaos. And so they're looking at having different lines, kind of like for those of you like me who've run races and based on your bib number or your speed, you go in different corrals, they call them. And so it'll be like that in some of those bigger vaccination sites where there's just large numbers of people. At ours, we're looking at things like how do you check in? Do we have more people for check-in? Where do we have waiting area or observation area? And just looking at ways we can be more efficient and move more people through with the same resources. At some point, we're going to get slowed down by vaccine availability and second shots. So let's say we get up to 360 a day. 4 weeks from now, we have to revaccinate those 360. So that day that we revaccinate them, unless we add capacity, we won't be able to do new vaccines. And so that's something we have to look at as well. Will the COVID vaccine cause your antibody test to be positive? I am not really sure about that. That's a question I can get an answer for you. I know that we're being told, I was scheduled to give blood on Monday. I've been pretty much giving blood every 8 weeks since the pandemic started. And I made an appointment, and it turned out the clinic newly was closed on that day, so they canceled my appointment. And they called me Tuesday and Wednesday, but by Tuesday I'd gotten vaccinated. And you can't give blood if you're vaccinated. I don't know why. It's one of those things that they're just, they think pretty soon they'll release that prohibition. But it may have something to do with an antibody test. You also, if you've had COVID, and you're donating plasma for the convalescent plasma treatment, you can't continue to donate plasma if you've been vaccinated. So I know of at least one staff member we have that has very nobly decided to delay vaccination in order to donate plasma for convalescent plasma treatment. And so lots of stuff we're still learning, but some things we don't quite have an answer to. I don't have any other questions there. Let's see, I have a few via text. Give me just a second. Will grocery store workers have an opportunity prior to the general public? I do believe so. I'm going to pull up this vaccine schedule again. I think they are in food and agriculture, and that's in phase 1B. If I'm not mistaken, I'm looking at the other ones. I'm pretty sure they're considered part of food and agriculture. So they're pretty close. If we're at 75 and over, which is phase 1B, and they're right below that, it'll be individuals 65 and over, and then food and agriculture, education and childcare, and emergency services. All three of those are right next in the queue. So yes, I do believe they will be next. And then I know two that work privately, their clients, not through IHSS, can they get the vaccine since they're in their 80s and 90s? They can get their vaccine in their 80s and 90s whether they're IHSS or not. That's available right now. If you go on the public health website, you can make an appointment for them right now. They'll open up the appointments, I say right now, but I know that all of the appointments through Tuesday were full. But they were going to release hold on just a second. They were going to release the appointments for Wednesday, Thursday, and Friday. Let's see if they're already full. Later today, they will release appointments for Wednesday, Thursday, and Friday of next week. And so they may need assistance. I don't know that they have email addresses, but if they can get an appointment, you can make it for them, or someone else can assist them to get that appointment. That's available right now. So regardless if you work in a grocery store or you're any of these later categories, if you hit a tier earlier by age or something else, you can get vaccinated before other people in the general public because you're in that tier. And so the 75 and older actually is after IHSS. It's just taken a while to get the IHSS up and running. And when I say a while, I mean a couple of days. Because remember, we just started vaccinating healthcare workers in the last week, and we're already moving through the tiers. And so some of it is kind of a very fluid, quick-moving process and looks maybe a little chaotic to all of you, but I can reassure you that we're just moving as quickly as we can. Through that. Okay, what is the plan for administering the second vaccine? I think I went over this before, but I'll mention it one more time, that if you got the first vaccine, then you had to register for that, and through that registration process, we will contact you and offer you appointments in the window of time for you to get your second vaccine. You'll need to schedule that appointment in order to get your second vaccine. So you should look for that invitation over the next week or so, and then schedule that appointment so that within that 28-day window of time, you get your second dose of vaccine. Let's see, I'm gonna go back to the questions and see if there's any other questions. I don't see any other questions, so if you have any other questions about the vaccines, you're always able to email dbhvax@fresnocountyca.gov, and they will see that your questions get answered. It's kind of our catch-all vaccine mailbox. If you think that, and the other thing I would encourage all of you is that if you have a colleague or a family member or a friend who works in the behavioral health field, hasn't gotten vaccinated yet, whether they are a contractor with the county or not, you can email DBHVax, and provided that they show proof that they work in the behavioral health field, we'll get them vaccinated. I think there's still a lot of people out in the public that don't realize that they're eligible for a vaccine, and we want to make sure that anyone eligible for a vaccine gets vaccinated as quickly as possible in the tier that they're in. What's happening right now is that as we look forward and we see that there's capacity in clinics for next week, and we've pushed out emails and we've pushed out communication, then we kind of expand a little more, push into other areas. And so still within the tier, but trying to ensure that everyone gets that information and has the ability to get vaccinated. So really appreciate all of you doing your part to follow the precautions, learn as much as you can about the vaccine, make an informed decision for yourself and your family members, and let's all work hard one way or another to get through this and get to that herd immunity so that we can get out of this mess that we're in. I will see you next week.